Welcome to Yashoda Hospital's online segment, the Health Talk session. As World Lung Cancer Day is observed today, to raise awareness about this, we are here today to discuss about this topic. Do post your queries on our social media network and we'll get them answered shortly. I'm Dr. Lakshmi and let's welcome Dr. Vamshi Krishna Reddy, Medical Oncologist Consultant from Yashoda Hospitals, Malakpet. Welcome, sir. So, sir, to begin with, how common is lung cancer in our country and at what age group people are affected?
Lung cancer in India, of late we are seeing more number of patients being diagnosed with lung cancer, and the age group we are seeing is quite young compared to what we see in the West, and we are seeing a good number of females also being affected by lung cancer. So the common age where we see most of the patients diagnosed with lung cancer in India is 40 to 60 years, and we are seeing more cases in men than women.
Do post your queries on our social media network and we'll get them answered shortly. So taking the first question, we've got Mr. Rajesh from Warangal. He wants to know what are the different types of lung cancer?
In lung cancer, we have mainly two types for deciding the treatment. One is non-small cell lung cancer, other is small cell lung cancer. So the main types of lung cancer are small cell and non-small cell, mainly to decide the treatment for these patients. In small cell, we usually treat them in a different way based on the stage. In non-small cell, again we divide into squamous and adenocarcinoma. So to treat these lung cancer patients, the diagnosis by histology is very important to decide their treatment plan.
So, sir, apart from different types of lung cancer, what is the clinical significance of the stage of the cancer?
So, in lung cancer, we do stage according to the TNM staging is what is usually followed in our country and worldwide. So, with this TNM staging, we divide lung cancer into 4 stages, 1, 2, 3 and 4. Stage 1 being early stage where the tumor size is very small, stage 2 where the tumor size increases bit beyond 3 centimeters, stage 3 and 4 is based on the spread to lymph nodes and other organs. So based on this stage we decide the treatment. For the early stages of lung cancer, the 1 and 2, most of the times we do offer surgery as the best treatment for these stages. Once the stage increases, stage 3 and 4 will not be able to do surgery for these patients. We'll have to treat them with either radiation or chemotherapy, targeted therapy and immunotherapy. Early stages have good prognosis. These patients usually do well and are usually cured of lung cancer. The advanced stages, that is stage 3 and 4, usually the cure rates are not that great. So we have to treat them with a multimodality plan, whether it incorporates the radiation and chemotherapy or targeted therapy to give them a better survival.
So taking the next question, we've got Mr. Prakash from Hyderabad. He wants to know what are the most common symptoms in lung cancer and when should one worry about this?
So lung cancer usually has symptoms like cough, which is the commonest symptom. So most of the patients, they will be having a new onset cough which is persistent and not subsiding. So whatever treatment they take, it usually persists. So cough is the first symptom and commonest symptom of lung cancer which is persistent. Second symptom being breathlessness, patient being feeling short of breath. So patients usually feel they are short of air and they have this gasping sensation. So that is another symptom which usually the lung cancer patients have. Third is related to the tumor. When it presses on the nerve, they may present with the chest pain in that part of the body. So if it touches the chest wall or the rib, you may have pain in the chest wall which is usually not subsiding with the routine analgesics which we use. Rarely we see patients presenting with blood in the sputum. So that is also another symptom, but we don't see it that commonly. We may see in 20 to 30% of the patients. And rarely if the cancer from the lung spreads to other organs, we may see symptoms related to the spread. If it spreads to the bone, probably we see the pain in those parts of the body. So all these symptoms, cough is one of the commonest symptoms for which most of the patients do report to the doctor. So any patient who presents with new onset cough and breathlessness or chest pain or recent change in voice which are not relieved with regular medications for a week or so, you have to consult your doctor and he has to check and tell whether these are good signs or bad signs, whether they do indicate any symptoms of lung cancer.
So, sir, what were the clinical challenges you faced in your experience during this pandemic in treating and diagnosing these patients?
During this COVID times, most patients with lung cancer were usually thought to have COVID and they were treated as COVID. So by the time they presented to us, either they had a COVID report which was positive, we had to wait for 2 weeks or 3 weeks before we did further workup on them, or there were instances where we caught patients having early stage lung cancers during this COVID because we were doing more CT scans for these patients to diagnose COVID-19 lung infections. So during this pandemic, of late, what we have observed is the number of patients with lung cancer being diagnosed in early stages has increased. So that's one thing, because the number of CT scans we have done, proportionately the number of lesions we have picked up in the lung has increased. For the treatment per se, yes, I think we did face challenge during the lockdown where patients had difficulty in coming to the hospital to take chemotherapy or to decide treatment for radiation. But once the cases have come down, we are treating them as we were treating earlier. And only one issue which usually is confusing for the patients is the cough post-COVID and the cough due to lung cancer, both at times overlap. So you have to consult your pulmonologist or your doctor, whoever is seeing you. And if your symptoms are not subsiding, even post-COVID, we have to rule out other causes of cough. So please consult your doctor if you have any persistent symptoms post-COVID.
So moving to the next question, we've got Mr. Vinay from Karimnagar. He wants to know, what are the risk factors for lung cancer and is it hereditary?
So in lung cancer, the most commonest risk factor throughout the world is smoking. So smoking accounts to at least 90% or more of the lung cancer cases we see in our practice in India. So if anyone asks what's the causative agent for lung cancer, it is tobacco, smoke related carcinogens. So other than smoking, the remaining percentage is quite less which causes lung cancer, like the pollution which we see, the industrial exposure where the patient or concerned person may have exposure to industrial chemicals, and other than the pollution and smoking, the remaining factors of hereditary is very small. So hereditary lung cancer is one thing which we see in non-smokers, especially in females, but the percentage is probably 1 to 5%. So the exact figures will be difficult to tell, but commonest cause for lung cancer, the risk factor being smoking.
So sir, talking about smoking, does passive smoking have significant effect in these patients?
Yes, passive smoking is what we have attributed to the increasing number of lung cancer cases in non-smokers, especially in both males and females, more so in females. So secondhand smoke or passive smoking is what we call when the patient inhales the smoke released by the active smokers. So the etiological agent, the causative agent, again is the same thing, the carcinogens or the cancer causing agents found in the tobacco smoke. So it can also cause lung cancer. So it has been proven that even secondhand smoke is not good, the passive smoking. So stay away from smoking, both active and passive.
So taking the next question, we've got Mr. Das from Orissa. His question is, which is more dangerous, smoking cigarette, e-cigarette or hookah?
So we have various types of smoking which is delivered for pleasure. So one of them, the commonest proven, is cigarette smoking. So as we are increasing awareness, people are decreasing the number of cigarettes they smoke to reduce their risk. So whatever way you smoke, there is definitely an increased incidence of lung cancer in these sort of activities. So the safest, there is nothing called safe, everything is harmful. So it's better to stay away from all forms of smoking, whether it is a hookah or e-cigarettes where they vape, or the smoking. So whatever way of smoking we do, definitely we are inhaling some chemicals or carcinogens which may cause pathogenesis and leading to lung cancer. So proven thing is cigarette smoking, which has to be stopped. E-cigarettes and hookah are the trend now because people feel they are associated with less chances of lung cancer, but it's too early to tell because it took a lot of time for people to think that smoking is bad and to stop it. So probably in the near future we may get more evidence that this is also not good, but with the available data, even vaping and doing hookah is also not good, and already in the West there is literature to even ban e-cigarettes or the vaping stuff even today.
Do post your queries on the topic lung cancer and we'll get them answered shortly. So taking the next question, we've got Mr. Gupta from Bangalore. He wants to know, do non-smokers get lung cancer as well?
Smoking causes lung cancer, so that is usually known. But there are non-smokers also getting lung cancer. So this is the first query which patients has to. I never smoked, so why did I get lung cancer? Smokers getting lung cancer is like 30% of them. In non-smokers, the chances are much less, but it is around 1 to 3%. So the non-smokers getting lung cancer may be due to variety of other factors, like first of them being the non-smoking etiological agent is the second-hand smoke or passive smoking. The other causes being air pollution, the industrial exposure, or rarely, very rarely, the hereditary thing. So non-smokers getting lung cancer is also not unusual, and if you have symptoms of any lung pathology, we have to screen for lung cancer even in non-smokers too.
So sir, talking about screening, what are the screening methods we implement in these patients?
So lung cancer screening is something which we offer only to those patients who are at high risk for lung cancer. So we do lung cancer screening with a low dose CT which is available with us. So what we do is we get a CT scan of the chest. Whom do we do? It's only for those patients aged 50 years to 80 years who have at least 20 pack years of smoking history. So what is this pack years? Smoking 1 pack per day for 1 year is 1 pack year. So if you are doing at least 20 pack years of smoking, and if you are aged between 50 to 80 years, you need to get a screening with a low dose CT scan of the chest. So what do we do in this? We get a CT scan and we identify if the patient has any nodule or lesion in the lung. If they don't have anything, again we call them up for the annual next year CT scan of the chest.
So taking the next question, we've got Mr. Karthik from Nellore. His question is, what are the treatment options for lung cancer and what are the newer techniques developed?
Lung cancer treatment is usually a multimodality approach where we have surgery, radiation therapy, and the medical management with chemotherapy, targeted therapy, and immunotherapy. So it's like a multidisciplinary treatment which we usually suggest for lung cancer. For early stage lung cancers, that is stage 1 and 2, we usually treat with surgery, and rarely post surgery if they require any radiation also. Based on the final biopsy report, we decide whether to add radiation or chemotherapy. For stage 3 and 4, it's usually with radiation or chemotherapy. The newer treatments which we offer for lung cancer are the targeted therapy and the immunotherapy. So these are the new kids on the block where we are treating with minimal side effects for the lung cancer. So these treatments are like hitting the target directly, like missile shooting. So we choose a target and hit it with the newer medicine. So we do not have the effects what we see with chemotherapy on normal cells. So normal cells are spared of the side effects with this newer targeted therapies.
So sir, what are the general side effects the patients face while undergoing this treatment?
So again, based on the side effects profile, we have to choose based on the treatments we have. So what treatment we choose, that implies the side effects you may have. So for surgery, you may have side effects which last for a couple of days to weeks, where the surgery related pain and symptoms will be there. For radiation, most of the times it's painless during the initial phases, but during the later course, you may have cough and skin changes based on the radiation. With the medical management with chemotherapy, usually we have side effects like nausea, that is loss of taste, vomiting at times, and very rarely body pains. With the newer treatments, that is targeted therapy and immunotherapy, we see this sort of side effects in a different setup based on the drug we are choosing. For targeted therapy, the side effects are usually very well limited because we do not touch the normal cells. So targeted therapy, it hits only the cancer cells. The side effects are related to only the symptom relief. With immunotherapy, that's another treatment which we use in lung cancer. We do activate our immune system to kill the cancer cells. So by activating the immune system, we at times see side effects related to the immune system activation, like fever or cough, or at times skin rash, and symptoms related to the gut, like vomitings or loose stools. So the drug we choose or the treatment modality we choose describes your side effects. So please discuss with your treating doctor about what is the treatment chosen, and based on the treatment chosen, you will be explained about the side effects you will be having.
So taking the next question, we've got Mrs. Sirisha from Secunderabad. She wants to know, after undergoing successful treatment for lung cancer, does it reoccur?
Lung cancer usually is known to recur, and it is being treated as a chronic disease now. So we do have patients who are undergoing treatment with us for more than 8 to 10 years who have been diagnosed with lung cancer. So lung cancer is now being treated like a chronic disease like diabetes and hypertension. And most of the times lung cancer is kept under control. We see recurrences or relapses in lung cancer. So we need to put these patients under close follow-up. The relapse rate is higher in advanced stages. It is less in the early stages. So if a patient is diagnosed with early stage, that is stage 1 and 2, the relapse rates are less. But for advanced stage like 3 and 4, we see the relapse rates being higher, upwards or more than 50 to 60%. So we do test them in regular intervals and see whether they have any symptoms or signs of relapse and decide accordingly.
So sir, what are the important steps one should take to prevent lung cancer, and what are general lifestyle modifications one can take up?
For lung cancer, prevention is the best thing which we can offer. So throughout the world and India too, the commonest risk factor being smoking. So the only best way to prevent lung cancer is to stay away from smoking in whatever form, cigarette, bidi, chutta, whatsoever it is. So stay away from both active and passive smoking to reduce your risk for lung cancer. And other than smoking, the other risk factors being having diet good in our fruits and vegetables, and also having active lifestyle and away from the pollution are usual lifestyle suggestions which we suggest to decrease your risk for lung cancer. So first and foremost thing in lung cancer is smoking and smoking. So if you are away from that, probably our risk of having lung cancer is less than 1%.
So this brings us to the end of this session. Hope all your queries on the topic lung cancer were answered. We look forward for your active participation onto joining us until next week. Thank you and stay safe.